Escitalopram or Lexapro is an antidepressant and anti-anxiety medication that can be used to treat several psychiatric conditions, including anxiety, depression, obsessive compulsive disorder, post-traumatic stress disorder, premenstrual dysphoric disorder. So the way escitalopram works is that it increases the body's response to a molecule called serotonin, just like Zoloft, Celexa, and a lot of the other SSRIs. What I like about this medication is that it's easy to dose. You could go from as low as 5 milligrams, and the maximum is typically 20 milligrams. So there's not much variation that one needs to do when taking this medication. It can take up to 4 to 12 weeks on the dose to notice the optimal effect, so it does need to take some time to work. It may take this long because it's thought it could make changes to the body's genes, which takes a little bit of time to process. What I also like about this medication is it does not affect the liver enzymes that much, whereas some of the other SSRIs can affect the liver enzymes. The reason this can be an issue is if someone has other medical conditions or taking other medications, those also work on the liver enzymes, and so sometimes the medications can interact or affect the levels of the other ones, and so Lexapro is less likely to do that. Just because someone needs a medication at a certain time in their life doesn't necessarily mean they always need to be on it. However, if there is a major depressive disorder or a major depressive episode or a major anxiety episode, it may be worth continue this medication long term to prevent any future episodes from happening in the future. Although it's important to have this discussion when changing the dose or stopping the medication with your doctor. Lexapro again works on serotonin, and there's a lot of serotonin in the stomach area, so not surprisingly, this is where a lot of the side effects can happen initially. Upset stomach, nausea, diarrhea, constipation. Usually after a few days those will go away, and one way to minimize those side effects is starting at a very small dose, maybe half of the tablet. Take that for a few days or a few weeks, give the body some time to get used to it, and then go up from there. Also, people who have anxiety tend to be more sensitive to this type of medication, so you can start at a small dose and build your way up slowly. Other side effects include inability to ejaculate or decreased libido. There are ways to get around this, such as taking another medication like Viagra or Cialis, or you can hold the medication if planned sexual activity is going to occur, and then resume the medication after the sexual activity. Although ideally this medication is something that is to be taken every day. There is a warning about increased chances of suicide with people under the age of 24. There's not really convincing evidence that this is true. It's thought maybe that people who are depressed, when starting the medication, they get more energy to follow through on the suicidal plans, and so that's one way it's thought it could correlate. But what we do know is that people who do commit suicide have low levels of serotonin in the cerebrospinal fluid, so in those instances it may be worth prescribing this medication to increase the body's response to serotonin. Overall, it's not clear how effective these medications are. Maybe 1 in 5, 1 in 7 people really respond to the medications, but it's often prescribed in hopes that the patient or the person taking the medication is the one that does respond. Other side effects to be cautious of. In cases of someone who has a bipolar disorder, a medication like this can make them a little bit more manic or hypomanic, and probably should not be used in those cases. That may need more of a mood stabilizer rather than an antidepressant. There's also this condition that can happen with Lexapro, along with any medication that works on serotonin, called serotonin syndrome, in which one gets really hot, flushing, sweaty, maybe they get diarrhea, muscle cramps, and it can get to the point where they get confused, shaking, and the psychiatric medication should be stopped at this time. In many cases, these people need to be in the hospital and get IV fluids to restore their dehydrated state.